Hamjambo. Now I am here in Nyeri, and I would wish to talk about the deplorable situation that has persisted in our healthcare, our hospitals, even with the whole hospital caring chain. I want to say that there is a total breakdown of the healthcare in this county. It has not just come now. It started some years back, but now it has reached very alarming proportions, where our main hospital, which was a provincial general hospital earlier on, which today is called, I don't know, the Fellow Hospital, today is really just a dead place. Even the staff are demoralized. There is no medicine, even of basic things. There is no instruments, and even the people working there are very, very demoralized. And I want to say this situation must be addressed right away. I want to say from the onset, I have been talking, and those who have been following my contributions know, I've always said the most important thing is to attend to the health care. Besides, for a human being, food. The next thing that comes in is one's health care. Then after that, you can talk of shelter, you can talk of other things of improvement. And I want to say, it is clear in this county, actually like in other counties as well, but in this particular county, we are putting emphasis on unnecessary things just because that's where there are kickbacks. You hear roads have to be built. I don't know what roads. The national government is building good roads, but I hear we are building some tarmac roads. We are putting cablo here and there. We are doing all kind of manner of things, but those things are being done, and from the estimation, hardly a quarter of the money is spent on the projects. The rest of the money is siphoned into other things, and that's why there is this urge to ignore healthcare and concentrate on things called the Malam roads. How can the county government be budgeting close to 900 million to do county road, these ward roads? Every ward about 30 million shillings. That's the money budgeted for. When there is no, drugs for diabetes, there is no drug for blood pressure, there are no drugs of malaria, there are no bandages, there are no simple utensils and the equipment to attend to the patient. Patients are being sent to private pharmacies to buy everything, even when a simple operation is to be done. If any operation is to be done on anybody, he has to buy detergents, he has to buy all this. Now, besides COVID, this is the worst situation that we can ever witness. And I must say, Nyeri has sunk to the lowest level ever from my history, and people must wake up and say no to this. We must demand that the county government starts giving services to the people. That's where we are here. And I want to say, as I said in the Senate the other day, Kenya will be Kenya. Nyeri will be Nyeri. Only when anybody who squanders public funds is dealt with quickly, and we fight them in committee with the prisoner's gown for a number of years, and they return everything they have squandered from the public. That's when Nyeri, that's when Kenya, that's when devolution will start being meaningful to the common man. And the people have been seeing. They have been seeing mansions coming up here. Even others I hear they own some other homes in Nairobi, big homes, and they are beautiful homes, they are homes with the flowers, lights at night to light the flowers. These are the kind of things that wananchi are being treated to, and it's a great pity. And I want to say, it's high time actually. The law took its course, and these people are dealt with. But I call upon the Nyeri county government to actually put their eyes onto the needs of the people.
Now there's
Well, it's not for me to say. People are suffering. Therefore, it's upon them to wake up and do their bit.
maybe from an
It's high time. It's not just an audit. It's a high time that action is taken from audit to actually dealing with, actual arrests to be done on people who have caused this suffering to the people. We passed the BBI. The BBI is a popular initiative. First of all, I want to come out clearly and say that I was a bit also perplexed when it was reported that, that the president cannot or should not really initiate popular this kind of memorandum. And I want to say the president is also a citizen of Kenya, and he is entitled like anybody else to actually initiate any form of amendment that he may feel Kenyans are demanding. But now the court has ruled as it has ruled, and we are a democratic society that lives by the rule of law. We respect the court's decision, and let us wait for the appeal. I believe the appeal will reason differently from what this particular court has ruled. But it's just a matter of waiting, but we respect the judgment. Other forms of approaches may be investigated after we exhaust the legal process of appeal and see what happens.